All right, so hey, here with Dr. Eric, and a good thing that we just thought about, he just thought about is, doing a quick presentation. Some of these people, you're not have time to do a full presentation, but you want a fast track, easy way to talk to your patient to influence them to get blood work and then get them back to thinking about the care you've done. So here's a quick way to go through the presentation really simply. Okay, I encourage you to write down the 3 main points. Again, number 1, our doctor specializes. B, we're a complete hormone replacement therapy center. C, we only use bioidentical hormones. Again, specialize, complete hormone replacement therapy, and we only use bioidentical hormones. So here's that's gonna go. So really quickly, Janet, our sister company, Buckeye Physical Medicine and Rehab in Gahanna, or our sister company, Buckeye Anti-Aging and Aesthetics here in Grove City. They're the largest and leading hormone replacement therapy centers in all of Columbus. And that's for 3 main reasons. Number 1, all of our doctors specialize in this treatment, and they have their diplomats with the American Academy of Anti-Aging Medicine, which is hormone replacement therapy. Too many MDs and DOs dabbling rather than specializing in it. 2, we're a complete hormone replacement therapy center, unlike the others. We're going to monitor several and all different hormone and vitamin levels to keep you at your optimum. 3, we only use the bioidentical hormone, Janet, which means they're identical to what your body produces. We don't do it MDs that do not specialize, which is use drugs to mock hormones or pharmaceuticals that have hormonal effects. No, we use identical to what your body produces, so it's 100% safe, effective, and recognized as such, okay? I've known several patients that their life have been changed through this. I myself am a patient as well. If you're not a patient and you're a doctor, become a patient, get your blood work done. So, Janet, hormones are deficient with time. Then when they took these hormonal levels, they took 20 to 70-year-olds, right? So when in the number they came up, for instance, testosterone in men, and they did these with all hormones, was 348 all the way to 1197. 348 being the 70-year-olds, 1197 being the 20-year-olds. The reason this is an issue is when you get tested by an MD that doesn't specialize and your levels are at 400 or 450, they would tell a guy he's normal, but he'd have the normal levels of a 67, 68-year-old. Not to mention the medical field says, as we age and get 68, 69, 70, we should just have less of the hormones to battle these anti-inflammatory processes, and it's okay, or symptoms and whatnot, and that leads you to more pharmaceuticals for them, okay? Moving on through. Hormones are deficient with time. There's nothing you do once to have perfect hormone levels forever, but the good news is all your ailments and symptoms are 100% treatable and reversible with treatment. Not to mention, for men, we give you HCG, which not only keeps the testosterone you do have, it keeps your body producing your own testosterone. That way your natural levels are never hindered, shut off, or dependent upon what we give you. Lastly, the largest study they have on hormone replacement therapy was done in 1999 by the VA. They took over 83,000 men and women, monitored their hormone levels for a 15-year period, 1999 to 2014. They took half of them and made sure they attained optimal levels. The other half was a placebo. And what we found at the end of the 15-year follow-up study was astounding. The half that attained optimal healthy testosterone levels versus those that were low and when untreated were 56% less likely to have died on all causes of mortality, 36% less likely to have had a stroke, 24% less likely to have had a heart attack. Reason being is testosterone is one of your body's most elite anti-inflammatories, so aches and pains go away. And let them know how this is going to help them with the inflammation fighting on the floor. B, battles heavily against insulin resistance, explain insulin resistance and weight loss. C, has a heavy effect on their regenerative rest and their sleep. When you tell them what testosterone is, let them know testosterone is one of their body's most elite anti-inflammatories. It's one of their most elite fat burners. It's one of their most elite sleep aids, and it's natural. Again, elite fat burners, elite anti-inflammatories, and one of their body's most elite sleep aids to get the regeneration they need. Let them know additionally, estrogen makes them feel everything that makes a woman, so if it's a woman, so their hair, everything that goes into being a woman. Additionally, heavy effect on bone and joint health. That's why when women are postmenopausal, oftentimes become osteoporotic. So because of all of those reasons, Jana, I believe you would be doing yourself a complete disservice into not even going to get blood work done to see if you have a deficiency. The work we're doing here on the therapy floor is vital. It's very, very vital. Additionally, onto that, you need to make sure you got the tools on the inside helping you heal with the efforts you're putting in. So get blood work done. That's my best advice, okay? That's all you got to tell them, guys. That's it. We'll handle the price that's not covered by insurance, the types of treatment. We'll handle every bit of that. Do not put that pressure on you. Love on Janet. Convince her to get blood work done because it's probably going to help her out. And if not, she can continue on the route, but at least she knows.
Gotcha.